Welcome to my channel, Health Manson's Hub. How your diet impacts prostate health, what to avoid for a healthier future. Welcome everyone. Today, we're going to delve into an essential topic for men's health, how certain dietary choices can negatively impact prostate health. As men age, the risk for conditions like benign prostatic hyperplasia, BPH, and we'll look at healthier alternatives that support better long-term health. Section 1. Red meat and its risks. Let's begin with red meat: beef, pork, lamb. When cooked at high temperatures, such as grilling or frying, red meat forms harmful compounds known as heterocyclic amines, HCAs. These compounds can cause DNA damage and promote oxidative stress, both of which are precursors to cancer development. Studies have shown a noticeable increase in prostate cancer risk among those who regularly consume well-done or charred meats. Alternative tip: try switching to plant-based proteins or fatty fish like salmon, which offer anti-inflammatory benefits and lower cancer risk. Prostate cancer increases, making it vital to understand how what we eat influences these outcomes. We'll explore specific foods and ingredients that research has linked to increased prostate-related risks, and more importantly. Section 2. The dangers of processed meats. Next up, processed meats. Items like sausages, bacon, and deli meats often contain nitrates and nitrites. These preservatives convert into N-nitroso compounds in the body, chemicals known to damage DNA and increase cancer risk. Alarmingly, even modest consumption is associated with a higher likelihood of developing prostate issues. Healthier swap: choose minimally processed options, such as grilled chicken breast or tofu, and keep processed meat intake to a minimum. Section 3. Full-fat dairy and hormonal disruption. Full-fat dairy products, cheese, whole milk, and cream, are high in saturated fats and calcium. These can elevate levels of IGF-1, a growth factor linked to cancer cell proliferation. Excess calcium can also interfere with vitamin D metabolism, reducing its protective effect against prostate cancer. Suggestion: replace high-fat dairy with plant-based alternatives like almond or oat milk, or opt for low-fat dairy options. Section 4. Harmful fats and cooking methods. Saturated and trans fats contribute to systemic inflammation and worsen lipid profiles, both risk factors for aggressive prostate cancer. Trans fats are often hidden in packaged baked goods and margarine. Additionally, frying food produces harmful compounds known as AGEs, advanced glycation end products, that encourage oxidative stress in prostate tissue. Better choices: use olive oil for cooking, enjoy more raw or steamed vegetables, and consider baking or air frying over traditional frying. Section 5. Alcohol and caffeine, double trouble for the prostate. Let's talk drinks. Alcohol impacts hormonal balance and damages prostate tissue over time. Men who consume more than 2 drinks daily face a significantly higher risk of advanced prostate cancer. Meanwhile, caffeine, especially in excess, worsens urinary symptoms associated with BPH. Better hydration: drink water infused with fruits or herbal teas instead of energy drinks or multiple cups of coffee. Section 6. Processed foods, sugar, and salt. A diet high in refined sugars and processed snacks leads to insulin resistance and elevated IGF-1, again, both known to drive prostate cell proliferation. And excessive sodium from packaged foods worsens inflammation and urinary issues due to fluid retention. Smart switch: focus on fresh fruits, vegetables, and whole grains. Use herbs and spices for flavor instead of salt. Section 7. Supplements and nutrient overload. While nutrients like calcium and selenium are essential in moderation, taking them in excess, especially through supplements, can backfire. High calcium suppresses vitamin D, while excessive selenium or vitamin E has actually been linked to increased prostate cancer rates in some studies. Pro tip: aim to get these nutrients from whole foods like leafy greens and Brazil nuts instead of relying heavily on supplements. Section 8. Other red flags: eggs and grilled meats. Egg yolks are rich in choline, which gut bacteria convert into TMAO, a compound linked to inflammation and higher cancer risk. Also, meats cooked over open flames produce chemicals called PAHs, which can mimic hormones that stimulate prostate growth. Prevention strategy: reduce egg yolk intake, favor egg whites, and marinate meats with herbs before grilling to reduce harmful compound formation. In summary, prostate health is closely tied to dietary patterns. By avoiding red and processed meats, fried foods, full-fat dairy, and excessive alcohol, and embracing a diet rich in vegetables, healthy fats, and whole foods, you can significantly reduce your risk of prostate complications. A Mediterranean-style diet is an excellent model to follow. Thank you for watching. If you found this informative, don't forget to like and subscribe for more science-backed health content.